Is Dr. Susanna Hills. She's a pediatric surgeon at Columbia University Medical Center. Dr. Hills, always great to have your expertise, and especially in light of COVID hospitalizations among kids recently hitting a record. I'm wondering why you think we're seeing this spike.
Well, clearly, Boris, we're seeing that those patients who are hospitalized right now with COVID are by and large people who are unvaccinated. That applies to adults and to children as well. We're seeing breakthrough infections for sure in those who are vaccinated, but the vast majority of patients who are really sick with this disease are unvaccinated and unboosted. And that really is, of course, the primary leading factor of also at this moment, we're having all of these holiday gatherings indoors, and that is a perfect vehicle for transmission.
Younger kids are becoming ill. Do you think that schools might have to reconsider their approach to reopening now after winter break?
Yeah, that's the question, right? So Atlanta's taken the move to hit a pause and give their kids a break and see how it goes over the next week or so. Right here in New York, we're planning to send kids back to school tomorrow. I think a few of the keys to deciding what to do are, one, what is the positivity rate in the community around the schools? And number two, what is the access to testing, masks, and the other things that are so important to helping mitigate the spread of this virus? So we'll see how things go. There will be lots of different strategies entering into 2022 in the school systems, but we'll see how things go here in New York. We've got tests at all of the schools that are available. But we'll see what access is for families at home who are trying to get tests, and we'll see how long schools are able to stay open without excessive positive cases.
And doctor, how should parents potentially change their approach?
Well, it's really critical for families to remember that those strategies that have worked against this virus still all along are still going to work against this new variant. Yes, the Omicron variant is more transmissible, but it's a respiratory virus transmitted the same way as all of the other strains of COVID-19. And so masking, hand washing, being very careful with indoor gatherings, trying to maintain some distance, and of course, testing if you have symptoms. These are all things that are still going to be effective. They may not cut the cases down as much as with the other variants because this strain is so transmissible, but there's still tools that will be helpful and will help cut down on spread. Of course, the key is if your child or a family member has symptoms of a cold or a respiratory virus, then getting tested and getting that person isolated if they are indeed positive is really important. So getting access to testing is key. And then, of course, if your family is unprotected, folks who are unvaccinated and who are eligible for boosters and have not gotten a booster yet, please go out and get that done. That really is what's keeping people out of the hospital right now.
Yeah, it's such an important message. Doctor, I did want to focus on comments from Dr. Jonathan Reiner. I'm not sure if you heard the soundbite earlier in the hour, but he talked about previous steps to mitigating COVID that might not be as effective during this new surge, 6+ feet of social distance, et cetera. If the answer is more stringent steps, how do you try to persuade a public that is already ignoring them and COVID fatigued?
Yeah, it's incredibly challenging. I think we have to just continue with the messaging that we've been using and to try to be available as healthcare providers to answer the questions that families have. But it's just so important for families to understand that they do have some control over this virus. And, you know, from my perspective, I really do believe that mitigation strategies like masking, like hand washing, like distancing, and avoiding excessive indoor gatherings really are critical to helping decrease the spread of this virus. It may be more transmissible, but these same strategies still will work against any respiratory virus, and that includes Omicron.
Dr. Susanna Hills, always appreciate your insight. Thanks for the time.
Thank you.
And a further discussion of COVID policies and the White House's testing strategy and what you can do